All right, perfect. I wash my hands. I brought my stuff inside, and I knock on the door. Good morning, Mr. Dan Jackson.
Hey, how are you?
I'm good. And what about yourself?
I'm all good, thank you.
Okay, and my name is Gabriel. I will be your treating physiotherapy for us today. And may I get in?
Yeah, sure, please
Yeah.
go in.
Thank you very much. Okay, sorry, Mr. Jackson. As you may see from the room, like there are two other people inside. Those are my assessors. They're gonna observe my practice and make a sort of assessment. Are you alright if they're gonna be here with us during the
Not a
treatment?
problem.
Okay, fantastic. Just to make sure I'm not making any mistakes with the patient, could you confirm your name and date of birth, please?
Yeah, sure. My name is Dan Jackson. I'm 39 years old, and I was born on the way whatever of the whatever.
Okay, fantastic. All right, sorry. Then, first things first, um, I would like to tell you what's gonna be our session for today. It's gonna last for about 45 to 50 minutes, in which first I will have to go through this thing called subjective assessment. I will ask you quite a few questions to have a better understanding of your situation in terms of the, 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 why you came over here and to have a better idea of your case. Then we will go through our goal settings for the day and even for the longer terms. After that, I will go through an objective assessment, which means hands-on assessment. I will evaluate a bit your condition, and after that, we might work again over the goals. If not, anyway, we would go through a treatment part where we work together to improve your condition. Is that all right for you?
100%.
Okay, fantastic. So I'm just looking around at the room. Um, it's nothing in particular in the room, nothing to be like he's sitting on a chair. Safety is fine. Okay, fantastic. All right. Do you mind if I have a sit?
Please
Thank
go
you
for
very
it.
much. Okay, so then I read from your file that you came over due to the fact that for about 2 weeks you've been you've been having this pain on your shoulder. Which shoulder is it? The right one?
The
Right
right one.
shoulder.
Yeah.
And you've been doing even an MRI,
Yeah, I done one.
which has got some results. But before that, like, could you talk me about what happened 2 weeks ago when you started having this pain?
I don't know really. I can't tell like a moment when it started. I just know that it started, and I start feeling like a sort of a pain, and yeah, sort of a pain in my, especially in this side of the shoulder.
Like in the front of the shoulder.
Yeah, it's like this side of the shoulder, and it's affecting me.
Yeah, a lot.
Pretty much to do all my
In
stuff.
terms of this pain, did it started one day like you woke up and you had this pain, or it slowly built up and
Probably-
2 weeks ago you were like, oh, I got this pain?
No, I can tell like maybe one day I was like, okay, I start feeling like a weird sensation on my shoulder, and
Was due to a
painful.
And it was not due to a particular movement.
No.
So the onset was like you felt like one day, oh, what's that?
What's
But
that?
you didn't do anything in particular.
Nah, not anything in particular. It was like, Jesus. I remember I was writing and was like a bit sore. So
Did you ever have problems on at the shoulders before?
no,
Or any
never.
other joints?
No,
any
I'm very
pain?
active, so no.
You're very active?
Yeah.
Yeah, fantastic. So in terms of how did it happen, you can't really say about it, you know?
No, was not an event, where I can tell you, okay, this happened and this led to started the pain after this
Okay.
thing,
Yeah,
I
fantastic.
couldn't tell.
Okay. And in terms of the current problems at the moment, like what's the main issue about it? Because you went for an MRI, so like
Yeah.
what's what the issue?
I mean the pain,
Current
the
problem.
pain, and I can't do pretty much the things that I have to be doing.
Okay, so the pain is limiting all your functions.
Yeah.
Like
Pretty much, not all of them. I'm still doing them, but with pain.
with
I can't stop.
Are you using more? Are you right-handed?
Yeah, I'm a right
Okay,
hand.
and do you actually are you kind of using more the left hand at this stage, or you cannot really do
I'm
it?
still happy to
And
use
do
my
you
right. I have to do.
and your in your activities you have to do a lot of weightliftings,
Yeah.
like 10 kgs, 5 kgs, 3 kgs.
Put this in picture. I'm a nurse, but
So you can
so
lift people
I have to
sometimes.
lift people, roll them up, and prepare the bombs and
And,
infusion
and about this
pumps.
pain, like for instance, I don't want to do any movements at the moment because we'll get there. But for instance, like, is it painful when you have to go over the shoulder,
Yeah.
and is it more like on this side, and is there anything in particular like that you
I
recall?
could tell if I try to reach my head, like when I try to comb my hair in the back,
Okay.
or when I need
So
to scratch my head
You can't even scratch your hairs at the
I-
moment.
with pain.
But
I
do you
can't do it
feel
with
any
pain.
sort of instability? Like, do you feel like, oh my god, it's popping off, something like that?
No, it's not like that. It's more like the fact that Jesus,
It's
so
really-
painful.
Like something like it's really inflamed. Do you feel?
Mm, I wouldn't be able to tell if it is inflamed, but
Okay.
feels like pain. You
Like,
know? I really
but
don't know
when you
what's
check it,
going on.
maybe you had a shower or whatever, where you looking at it, is it any swollen?
No,
Like
doesn't
in-
seem to.
Like redness?
Nah.
Is it warm?
No, not really.
Do you feel it like kind of palpitating? You know what I mean? Like it's,
Yeah, I know what you mean, but no, there's no signs of like any pulse like pain. No.
and like let's stay on the pain for a moment.
Mm.
Like this pain, is it constant or intermittent?
Well, I can tell that this is constant. I have pain like during the whole day.
During the all day,
During the whole day.
no matter what you do.
No matter what you do. I mean, yeah, pretty much the
Constant
whole day.
pain,
Is it constant pain?
but is it aggravated by anything?
Yes. Each time that I try to use my
Whatever
hand,
use you do to the arm. But for instance, as if you have to
I mean,
bend
if
your
I
elbow,
have to bend my elbow,
That's
that's
fine.
fine.
and
if
like,
I
is
have
it
to do
related for
something
you
here-
with your neck movements as well? Like if you
No,
bend on the side or whatever.
No, it's not related to my neck movements. It's even though I can put my put my shoulder on the table and start typing there
And when I
and
do it,
writing.
is it painful when you do it like that?
I mean, just move. Jesus, this is so
Yeah, but
painful.
if you do it like with the other hand, is it painful?
Not too much. It stays
Not
the
too much.
same.
Okay, oh, that's
It's
interesting.
more the fact that
So-
I am moving the when I'm trying to lift my
Yeah.
arm, it's bloody painful.
So, but anytime you want to do the movement with this arm,
Yeah.
it gets worse.
Yeah.
And when it happens, like, is it how long it lasts? That spike of pain.
Well, as soon as I try to move it, it rises to I don't know. It is, it's high pain.
High pain.
High pain.
Okay, so when you try to do it yourself, it's really painful.
It's
Okay.
really painful, and it takes like probably an hour
Is there
to settle
something that
down.
helps you to release the
Rest.
pain? Rest. So doing the rest, like.
I do rest.
But it's still a bit pain even when you rest.
Yeah.
But during the night, how is it this pain?
Well, it is hard to catch a sleep, but as soon as I catch a sleep, I don't
You
have
get-
problems.
Yeah.
But the fact is that as soon as I start sleeping over my right side,
You don't sleep on your left side. Yeah.
I do,
And
but because this is how I do sleep during my
Why
whole
don't you
life.
try to sleep on the left side? You know, like you could use a pillow
I
underneath your
could,
arm.
but I'm used to sleep on my right
But-
side.
Just,
you know.
just for I didn't check yet, but maybe try to sleep on your left side for the moment, and keep maybe pillow here and another one in the front, and you keep it resting.
Maybe I can
it-
try.
It's just a big help about it.
I will
Anyway,
keep
like,
that in mind.
do you feel you had some sort of difference in the sensation lately due to this pain? No?
No,
No? Okay. But is your strength affected?
certainly.
Yeah. Because of the pain, you would say?
Yeah.
Okay. Do you do any sport which involves this arm? Do you do any weightlifting, basketball,
Nah.
rugby?
No.
Nothing of the kind?
No.
So
I like
you-
to do soccer,
Okay.
but
So
I
but-
haven't
but
been
you-
able to do.
You haven't been
not
doing
at all.
like any sport, footy that involved the use of that,
Nah,
so
not
you didn't
much.
have any trauma.
No.
Okay, that's fantastic. In terms of your arms, is it swollen your arms? No, not. Okay. So you said you didn't have any problems on the arm before.
No.
Okay.
Was pretty-
But
pretty
any
fine.
other part of your body, did you have any surgeries before? Okay. Do you have any thyroid problems?
No.
Okay, and what about diabetes?
I'm pre-diabetic, to be honest.
Okay,
I'm not taking any meds. We are managing with just having a better, meals and lunch
you
and stuff
coping
like
well
that.
with that?
Coping well so
Okay,
far.
and it's
I have
under
gained,
control.
weight in the last 6 months,
Okay,
10 kilograms. But yeah, my GP is already aware of that, and we are
okay,
working slowly,
okay, okay.
working on that. It's just that this life is so
Yeah, it's alright.
crazy, man.
Any chest pain or heart diseases?
Nah,
No. Fantastic. Any arthritis in particular?
nah,
Rheumatoid arthritis?
not at all.
No. Epilepsy? No. Okay. Yeah, yeah. Sorry about the questions, but I need to. Have you had any night sweats or something like loss of weight, like that you couldn't explain? Any dizziness?
No,
Nausea?
not at all.
Okay. Any? Sorry about the question. Any history of cancer on your family or
Yeah, I have familiar history of cancer.
what type of cancer, if I may ask?
I don't remember. I
Not
know that
osteosarcoma or something like that.
I can't tell.
You
I
can't
really
tell.
don't
But you
know
didn't suffer
because
of any.
I was quite young when did it happen to my auntie.
Okay.
So, but I don't know what type of cancer was it.
Okay. Any? You don't suffer, I suppose, of osteoporosis, problems of the bones.
No,
Okay. Uh, do you actually smoke?
no.
Okay. And do you drink any alcohol
Every now and then,
every now and then?
just
Like
yeah, when I
how
catch up.
how frequently, if I might ask?
No, I'm alright with that. I would say almost once every 2 months.
Once, oh yeah, like oh, okay, perfectly fine. Yeah, okay. You're
Just
under
when I
control.
met with the friends and because this life is so in a rush. So
Yeah.
each time that I have time, I get with my friends and have a beer. Probably that's it.
Okay. And in terms of medication, for generally speaking, do you take any medications?
No,
So
no,
you,
no, no,
if there's any pathology I should aware of, or something I should aware of that might make the difference in my diagnosis or my.
no, 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 Gabriel. No, I'm
Okay.
pretty healthy
Oh,
apart from.
sorry, I didn't ask you. Like, is it alright if I'm calling you Jack? Is it
Yeah,
alright?
no,
Yeah.
it's perfect.
Sorry
Fine.
about that.
No, 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 that's alright.
And in terms of the medications for this pain, you've been seeing your GP, haven't you?
Yeah,
Yeah, and you're gonna visit him again the 10th of August,
yeah,
which is about in 4 weeks, let's say.
yeah.
Did he give you? Did he suggest any
Yeah, it
painkiller?
was a bit weird that suggestion because was I'm not too sure what should I do with the painkillers. I'm not too sure. That's the fact. So I've been because I'm a nurse, so I'm kind of aware what should I take. I'm taking Panadol every now and then when I feel the pain, and before going to the hospital to do my duties, I take two Panadols and then an ibuprofen. So I'm doing like
Just
I
so
try
you can
myself,
cope with the pain? Or,
sort of.
I understand, but maybe it's better to have a sort of a procedure in the term of usage of the medications with your
Mm,
GP. Like since you've
yeah,
been seeing,
probably.
yeah, like I understand that you work with this kind of things, but
Mm,
still, like having some more particular, specific advice would be good. And it's I either couldn't suggest you what to do like properly, so I
mhm.
would definitely recommend maybe just to mail maybe your GP and say what should I do? Like, is it alright if I take two Panadols and you say ibuprofen?
Yeah, we already have booking for in probably 4 weeks time or
Yeah,
6 weeks time.
yeah, but it's 4 weeks, so you might even just mail him and say, I'm sorry, like,
Mm.
just in terms of pain, I'm taking two Panadol in the morning, you said, and
Yeah,
ibuprofen. And what about the evening? Do you take anything else in the evening?
it's more like when I feel the pain, when I feel like it's getting out of my hand, then I get the Panadol in.
Okay, so, alright. Did you take any Panadol at the moment?
Um, not today.
Not
No,
today. Okay.
no, no. Because it's my free day, so I'm not taking anything.
Okay, fair enough. Yeah, I would definitely suggest you just, it's Panadol, so it's,
Mm.
but still like to have suggesting by your GP would be better.
Mm.
Secondly, like I would like to talk about how are you coping in your everyday life. So I see you are a nurse.
Hmm.
Are you working at the moment?
Yeah, I can't stop it. I
Full
can't
time?
stop full time.
Okay. And I think it's pretty demanding. Like what kind
Wow.
of, like, sorry to demand, but
No, 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 no.
what,
It's alright. I work in a hospital setting, So it does involve like lifting patients, preparing medications. Um,
At work, are they aware of your situation?
I can't tell them because they are, they are getting rid of a lot of people. So I can't take the chance to lose my job. I can't.
Okay,
You know what I
so
mean? So
okay,
I'm like trying to
so
hide
so
this.
you're trying to hide it.
Yeah.
Oh, okay, so and so you're not coping really well about it. I mean, like, there's no way like you could ask maybe to change a slightly bit your activities. You,
I don't know because I'm kind of afraid of just telling them something because they could fire me, tomorrow, and I can't take the chance to lose my job.
and this thing is bringing you a bit down, I suppose.
Not down, but I feel like really stressed about it because you can't stop working. You got bills to do. You have commitments, and
Like, who do you work with? Who do you live with? I'm sorry.
yeah. Well, I live with my wife. She works like part time. So
Have you
yeah,
got kids?
my main no, we don't have kids. So my income is the main income for
Okay.
the household.
Because you own the house, you paying for the house, or
We are paying the house. So
okay,
if we don't pay, basically they're gonna take the house out of us. So
okay. So like it's not in my scope of practice, but is there anyone I could refer you to, like maybe a psychologist to talk about it, or even the social worker to look
I
in the
feel like
situation?
I don't have time to do that. I mean, between my jobs and my wife and my stuff, I
Oh,
don't feel like there is free time for that. I don't know.
like, well then, like you are Halid Health, and for both of us, this kind of field is not our scope of practice. But what
Mm.
I can tell you from my experience about I didn't do an objective assessment yet,
Mm-hmm.
so I cannot say what's that. But not having the appropriate rest, or at least to change the, the functions that you're having,
Mm-hmm.
is gonna be extremely detrimental for your condition.
Mm-hmm.
So things unluckily are like unlike to get better just by doing the same things. Now, of course, I will do the objective assessment. I will look at the treatment, what I can do, but definitely you should try to get some rest. But if the situation is even like too stressful for you, like you don't have to risk to get a burnout about it.
Mm.
So I could recommend you to um, refer you to a psychologist if you want to talk about it, or
Okay,
even the
we can give
social,
it a shot.
and you could even like talk with the social workers to maybe help you in this situation if it's.
Mm.
I'm not sure, but
Yeah, well, neither I, but maybe we can give it a shot. I don't know.
like what I'm gonna do at the end of the session, I'm gonna write a mail where
Mm.
I'm gonna explain what you've been doing. I'm mailing you the exercises possibly that we're doing, but moreover, I'm gonna contact your GP as well, and I'm gonna even present him the situation.
Okay,
So
sounds good to me.
possibly we can try to work as a team and to make it better for you. Is that
Yeah,
alright?
sounds better. Sounds good.
Okay. In terms of so the house you live in is a single story house, double
This
story?
is a single story house. There
You
is no
coping well with
steps.
the house?
Not a problem.
You said you're pretty active. Have you got any hobbies or something?
Well, I like to play soccer. I like to go, to the beach and have
Yeah.
some surfing there. Yeah.
Okay. And how is it like? Are you still doing these things? Are you alright?
No, I'm stopping there because I can't do it with my shoulder. I barely can do my job, so I'm not
Okay.
putting my shoulder in more risk.
Yeah. Um.
Because
uh,
I really don't know what's going on in my shoulder.
so what would it be for you a goal to see from today's session?
I probably it's hard, but I want to get back to my normal life. You
Okay.
know.
So like you want to get rid of this pain, having your shoulder working properly, but like you kind of understand that probably this might be a long-term goal, because
Mm-hmm.
from what you said at the moment, the pain is pretty high. Like you are at rest now. What's in a scale between 0 and 10 is your pain? Are you used with the VAS scale? Like
No, I don't know.
so
I'm not
10
using
it will
it.
be like the worst pain you ever had,
Mm.
and 0 is no pain completely. Like at the moment, since you said it's a constant pain, how much is your pain?
Oh, I could tell probably 2 to 3
2 to 3 at the
when
moment.
I'm not moving at all. So it's like constant pain, soreness, and
And when you move it, you got these sparks.
6. 6 to 7, yeah, per week.
I didn't ask you like, does do you feel any numbness with the pain? Any any shooting kind of electrical burning pain going
No.
down to your
No,
arm?
no, it's no. No,
Does
it's
your
just
hand feel funny like pins and needles, something like that?
no, not really.
Alright, so what if for the show goals we say like we try to improve this pain and give your shoulder a bit of movement back again so we understand how to cope with it?
Maybe we can, reduce a little bit the pain.
Yeah,
That would be.
definitely. That's what I would do. And secondly, as a long-term goal, we could say like getting back to a normal activity.
Yeah.
Okay, fantastic. So now, Jack, I would go as a objective assessment, which means like hands-on. Do you allow me to proceed?
Go for it.
Okay. So first of all, I would like to observe the area. I see, like, do I see anything in particular about the posture? He's keeping up the arm. Okay.
Just see what you see.
Okay, you're quite relaxed about it. I see you got a bit of a jacket on top. Could you just take it off? Show me like.
I will try. This is what I do.
Just pretend it's so cold, bro. Like.
No, I'm alright. Let's be a really good patient.
Is it painful just like that?
Yeah, man.
Okay. Do you mind if I have a look at the shoulder area?
Go for it.
Okay. Sorry, my
First
hands
go.
are a bit cold. I will
Go for
just bring up your. Okay. I'm looking for some redness.
Just see what you
bruised.
see.
Is
There's
it
nothing.
bruised? Is it
No.
swollen? I touched it for the temperature.
Doesn't seem different on the other
Doesn't
side
seem
of the
so
body.
different. Okay. I'm sorry. I'm just gonna palpate a bit the area over here.
If
Do
you
I
gotta
feel
go
it?
deep, that's fine.
Do you
Can
feel
go.
it very tight?
Yeah, it is tight. This is
It's
so
tight.
yeah. It's
Do you
sore
feel
around
any
it.
kind of contractors on top?
Yeah, sort of. It's really tight. And
Tight.
it's sore around the scapular area.
Okay. And what about now? I'm gonna feel around the acromial part. I'm gonna touch the ligament. And is it painful over here?
Yeah, sort of. It's not too bad. I mean,
You said that the pain is anterior. It's not over here though.
no.
Is it in this area maybe more?
Yeah, it's more like around this area. Like, if I could tell, it could be
This-
something like that.
This area, and it goes down a lot. Like if I take your arm, sorry about that, like that, and I will like just move it a bit like that. What about here? No? Okay, fantastic. I will just lay it down again. Is it much pain in here?
No, it's just tight,
I don't see any sign of any particular stuff. Okay. Thank you for that. Now, I would like to have you moving your neck if you could. Could you just flex your neck as much as you can? And then you go up. Any problem with your shoulder while you're doing it? Can you turn your head to your left?
Just feel,
A bit of
tightness
tightness.
there. Yeah,
And in the other side,
not too bad.
can you side bend it? And again,
Oh, I feel sore in here.
you feel sore. Sorry about that. Sorry
That's
about
alright.
me touching. Let's go like that. Is it painful?
Yes, but it's not pain. It's more like
Yeah.
the fact that it's.
Yeah, but it's very different from this side.
Yeah.
Okay.
Not in particular. It's just
Nothing,
that the
nothing in
muscles are
particular. Okay,
tight.
fantastic. We just wanted to clear the presence of any problems to the neck.
Cool.
Then, could you please do for me a movement like opening up your arms as fast as up as you can? Is it painful in this range?
Yeah.
Could you tell me when is it painful when you
Probably there.
now and it's all
Yeah.
painful going up?
No, there is no pain here, but there is that.
Okay, in this part, and you
Yeah.
can go more than that.
No, because it's so painful. Can't go
Okay.
over.
Can you keep your hands like that?
Mm-hmm.
Can you move them around like this? Is it painful to do this movement?
Mm-mm.
And what about this doing this one?
Not too bad. I mean, it's
Not
like
too bad.
Probably a 4 or 5. I mean,
But it's still painful.
it is painful.
So that's a 4-5, but when you do this one,
Yeah, that's definitely painful.
okay, if you may, I will just do the movements myself.
Mm-hmm.
Okay, so like stay completely passive.
Mm.
Is it painful doing like that? Any pain? Any pain? Any pain?
No.
No pain. Okay, this is very
I mean,
good.
just probably in the last part is just a little bit painful here.
Okay, so if I go here, this part is painful.
Just a little bit, not too bad, like a 3-4 probably.
Okay, this last part is painful. What I'm touching about? Like,
Yeah, probably I would say like here.
okay, all right. When I'm doing this movement here, no,
Nah.
this movement, just a bit of tightness.
Yeah, tightness. Probably when you go here, when you go try to go here, it's a bit more painful. When you try to do it by yeah, that's yeah,
That's quite painful.
Yeah.
Okay, all right. Can you go up? Any pain doing that?
100%.
Okay, but if I do it myself, any pain like that?
I'm not doing anything. I'm just letting you do it. No.
No pain.
No.
Okay.
Probably same
Just-
as before.
Okay.
Just in the last part.
Okay. Okay. That's very good. Now I'm gonna do some muscle testing.
Cool.
Okay. So the first thing I want you to keep your hands like that. Can you? Like that. Can you resist me? Is it painful?
Yeah.
It's painful.
Yeah.
How much pain would you say?
6.
And it's about a bit weak, but I suppose it's due to the pain.
I can't tell. I know this is painful, and that's why I can't do much.
Can you do this? Okay. Can you hold it for a bit?
Not much.
But it's very very painful. Okay. Could you, for me, extend? Okay. Can you hold it? No. Hold the arm like
Yep.
that. Any pain?
Not too bad. I mean,
Okay.
it's still painful, but it's not.
Can you hold it like that?
It's
Any
not
pain?
too bad. No,
Okay.
not really.
Just to see like if it's everything alright with the like proprioception, which is mean like the way the joint is perceived. Since it's the arm, I want to see that it's everything fine. So
All right.
I will do like that. Okay, we'll hold your thumb and I will go up, down, up, down, up, down. Okay, I want to tell me when it's up and when it's down,
All
but
right.
you keep your eyes closed if you may. Okay, okay, up. What is it?
Down.
Okay. What about now?
Up.
What about now?
Down.
What about now?
Up.
What about now?
Down.
Okay, fantastic. Thank you very much for that. Like in terms of, do you feel any difference in between those two?
No, not really.
Not difference, eh?
Still the same.
Not any difference?
No.
Okay, that's fine. All right. Now, what I would like to do, it is one last, like a few tests. So, the first one, I want to try this test, which is called the scarf test. I'm gonna test this particular junction here because you add on your movement pain on top. Okay, so I want just to see if the pain is it painful?
Upbeat, yeah, I would say like a 4.
Like a bit painful when I'm touching.
Yeah.
Okay. Now, secondly, I will do a test to see, to squeeze a bit your tendons inside your joints. And to see how
painful.
This is already painful.
Yeah. I mean, it's not too bad. I'm not doing anything, but
How painful is it in 0 to 10?
I would say that 4.
4.
Yeah.
Okay. Now, though, I would like you to keep your hands like that. Can you hold it for me? Hold it. Any pain? This is very
100%.
painful.
Yeah, 100%.
Okay. All right. So, as far as I can say, you you had a bit of movements that were painful. Like this last test was for a muscle called the supraspinatus. Okay, it's a muscle that of the rotator cuff. Like it's quite important on the managing of your shoulder. Plus, you had some kind of pain in the below. It's called your subacromial space, but it's probably from your MRI. It's seen that there is a bursa that is a bit inflamed. You got an acromion that is called type 2, so it's slightly bent. Like there are three types of acromion. One is straight, one is slightly bent, another one is very bent. You got the number 2. And plus there are some tendons that, because they are suffering due to the load that you've been doing, they got bigger. So this space is a bit slighter, okay? And it gives you a bit of pain due to the fact that some tendons are inflamed, especially the supraspinatus tendon, okay? Moreover, I wanted to try, sorry, could you hold your hand like that? Hold it. Is it painful?
A little bit, yeah.
A little bit,
Not
okay.
too bad. I mean,
And that's
for-
the
as well.
internal rotator. It's called subscapularis, which
Yeah.
was like suffering. Okay, so in my opinion, the main issues at the moment is that tear on the muscle. Okay, that tear on the muscle, on the tendon, it takes a bit to heal. Okay, okay. To heal, it's appropriate to manage the load of what you're doing. So managing the load, having some rest, and then doing some exercises. What I'm gonna do now is first I'm gonna just do some soft tissue treatment around your shoulder, just to try to.
Yeah, that feels good. I mean, that's what I need, I think.
You can feel like you're very tense on this part of the muscles.
Yeah.
How much time you got coming?
That's alright.
What's the time in there?
30 something,
Okay.
36 or 37.
What we can do, come in, and we'll just speed up because I got the idea. But so I would do like the messaging.
Yeah, go for it. Not a problem, buddy.
Is it too painful over here?
A little bit, yeah.
I can feel like all your muscles around are pretty tight.
Yeah, they are.
And it's due to the pain, of course.
Yeah.
Would you be able for me then to try to raise up a bit your hand, your arm like this? Is it
Like
painful?
so? Yeah,
And
it
go
is.
down. Is it as painful as before?
Probably a little bit less.
Okay, can you go up
I think it's better.
to
Bit better.
just
Since you're helping with your elbow, yeah.
3, and then we're doing let's try to go up. Any pain like that?
Yes, but it's not as bad as before.
Not as bad, okay. And again go 2. We don't want to provoke too much the pain, okay, so we stay on ranges that are not too painful. And again up. 3. Okay. Lay down your hand.
Cool.
Is it too hard?
No, it's alright. It's alright. Feels good, actually.
what I would like us to do is to try to mobilize a bit of your shoulder. These exercises that we're gonna do are the same that we're gonna do again. Okay, now here we've got the plinth and bam,
All
I'm
right.
keeping up the plinth.
All right.
Okay, so we want to give some movement to start with, really easy, okay? So you would have a cloth, and as a first movement, we would do like going up and behind, sliding further and going
Forward
backwards.
And backwards.
Is it painful like that?
No, because I'm holding my
Okay.
my shoulder there.
Fantastic.
So it's
And we
not
give
too
back
bad.
movements to the shoulder,
It's not too
and we are
bad.
even mobilizing a bit the scapula.
Let's pretend
That-
I am with the
Yeah,
plinth
yeah,
here.
yeah, yeah.
So yeah,
So we do some movements like that.
like that. I shouldn't reach forward like so.
Oh, you don't want to bend your back, but you want to use actually your shoulder blade. So you want to go far.
So you don't want me to go like that?
Not
but-
at the moment, not at the moment, because if
but-
we go like that, we're gonna have more angle. That's the next part. So you
Okay.
would start like that,
Okay, so I'm holding the cloth here
and
and
it
I'm trying
slides.
to reach forward.
Exactly.
Alright, cool. Okay.
After you've done 6 to 10 passages of it, you start slowly to do what you said, bending over. But remember that when we bend in the trunk, we're going to open up this angle. Okay, so it's gonna be a bit painful. Just try to do it. Yeah.
Like so.
And you can go forward,
Alright.
go, 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 go. Okay, we want to keep the pain on a bearable range. Okay, I would like to be on a 3 or a 4. Okay.
I'm already on a 2 to 3, so
Okay.
as soon as I start moving a little bit, it's 4 to 5.
Okay.
I'm not,
That's still good.
you know, the plinth is holding my arm, so
Yeah. This is
not too
this
bad.
is
It's
still
4
good.
5.
And we're giving it a bit of movement.
Yeah.
Okay. And you bend, 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 bend. Fantastic. And stop. And then by standing up, Jack, we would do the last movement the same, but on the wall, sliding
here?
up. Yeah.
Alright. So how is it?
Oh, lateral on the lateral surface. So
Yeah.
you would use your your right arm, and you would go up and down. Always though keeping control. No, laterally. So
like so.
facing the wall.
Facing the wall.
Facing. Sorry. That wall over there.
Alright.
Okay. And you would slide up. Any pain?
Yeah.
How much?
I would say like a 5 to 6.
Okay. We want to go lower than that.
Yeah.
Is it better like that?
Not really. I mean,
Okay. Maybe it's just too soon for that. Easy. No problem.
because I feel like I'm doing like big effort here, just trying
Yeah,
to rise.
it's alright, it's alright. Now, I want another exercise to do. We to take this cloth.
Mm-hmm.
We're gonna do 4 exercises with this cloth.
Mm-hmm.
I will mail everything to you, okay?
Yeah. Alright.
Okay, all these exercises. So the first one, look, it's gonna be like that. You use your arm, you stay 90-90,
Mm-hmm.
you bring your fist on it, and you push.
Alright.
And you hold the push for 5 seconds.
Cool. Got it.
And you do 5 times 5.
5 times 5.
Okay, now we just do a couple, because I want you to assess some other things.
like that.
Yeah.
1. Feels good actually. 2.
3.
Sorry, I need to
Four.
hold 1, 2, 3, 4, 5.
Nice.
Yeah, it's
And
not
that's
too
one.
bad.
And then again. 1, 2, 3, 4, 5. And again.
Cool.
And we would do it 5 times 5.
Cool.
Okay. Then another exercise that I would like you to do is on the lateral. Okay, so it would be better to have a column of whatever, like the entrance of the door. Let's pretend we are on
On the edge of
on
something.
the door, and you would like have the fist like that, and you would do 5 times 5.
Alright.
Okay, so we
Alright,
do-
got it. So let's pretend that we are in the edge of the wall and then hold for 5,
Yeah,
3, 4, 5.
yeah.
Right.
Any pain doing so?
Yeah,
A little
not too
bit, but
bad.
it's under control.
4 to 5
Okay,
probably.
remember that then you continue. We got to give back movement to the shoulder, and the movement of the tendons or these isometric exercises that I'm giving you are gonna help to bring nutrients to the muscles, to move a bit the muscles, and to improve the condition. So it will possibly improve your inflammation. It means it will lower it. Plus, it will strengthen your shoulder, and it will help it to heal. Okay. So that was the second one. And then on the same column, you would use your elbow against it, and you would stay like that, and you will push backwards.
Push backwards.
Yeah.
Okay, got it. Sorry.
No problems.
3, 2, 4, 5.
1,
1, 2, 3, 4, 5.
2,
1, 2, 3, 4, 5.
3,
3, 4, 5.
4. Okay. And then we got the last exercise, which is the exercise where you do
The
like
wall.
internally. Okay.
All right.
We've done externally. We
So
do.
there's a wall here.
Yeah.
Cool.
And
And
you
that's
and
gonna
you
be
90, 90, and you,
1.
I know like it's hard to
Two.
remember all these exercises, but I will write them down and
Yeah,
I'll
thank
mail
you.
it to you.
Yeah,
Okay.
because I have a lot of things in my mind.
Yeah, of
Fine.
course, of course.
1, 2, 3, 4, 5. 1, 2, 3, 4, 5. Cool.
Okay, fantastic. Then I gave you so that series of mobilization, this exercise, and then I would like us to work a bit on our shoulder blade. So the exercise is still a kind of an isometric, which is holding the position, and you would hold your shoulder blade together,
Like so.
yeah,
Yep.
and release it. You would hold them for 5 seconds, and you could even count 101, 102, 103, 104, and 5.
2, 3, 4, 5.
Two.
Not too bad. 2, 3, 4, 5.
Okay. All right. Could you have a seat again, please?
Yeah, sure.
What's your level of pain at the moment? What do you say?
I would say it lowered a little bit to 1 to 2. It was 2 to 3 before, so
Yeah.
a bit better.
And would you be able for me to do this movement again? Okay, that's a slight improvement. Is it so painful again? Like still?
I would say that I have to stop because of the
Oh,
pain.
yeah, just stop. Just stop. You don't have to do it.
Yeah.
Okay, but it's slightly better. What about this movement?
Yeah, it's not too bad. I mean,
That's very good. Okay, so as I said, then what I'm gonna do is write down these exercises and send them to you. I would like you to do possibly twice a day. Okay, the series.
okay.
It would be good if you would do it if you have to go to work before going to work, so you warm up a bit your shoulder. But if you got some breaks at work and you even like you can base these exercises, it doesn't mean that you have to do them all together. Or so these isometric exercises, for instance, you can do it every now and then during your work day, or even the squeezing of the shoulder blades. But please, like, take some moments during the day dedicated only to the exercises, because it's quite important. Secondly, I will mail your GP. I will talk about what we've done. Please, like, make sure I will do the referrals that we'll be talking about, and make sure even you that you talk about him, about the managing of your painkillers or anti-inflammatories. Moreover, I would like to see you, if possible, twice a week for till like you get a bit better. Just because I've seen that you don't find much time to do stuff or exercises.
Yeah, well, it's getting harder, to be
And
honest.
it's quite important that at the moment you try to cope with the situation and it gets better. Have you got any questions for me at the moment?
Well, I don't know the results of the MRI, but
Okay.
you already told me that one of the muscles is
There
teared.
is a little tear on
Yeah,
the...
I'm not aware what's going on in my shoulder, so probably you can tell me, or the GP can
Yeah.
tell me what's going on.
No, like, so what's going on basically is that you've been apparently like loading your shoulder quite a lot, and we got to a point of overload where some structure started to be inflamed, like the bursa, which is a structure that protects from friction in between the tendon and the bone or the joint, and that's a bit swollen, and it's actually painful when it is swollen and when it's inflamed.
Mm-hmm.
Plus, you got some inflammation on some tendons, like the tendon that made you do this movement,
Okay.
and even this movement, and you got a tear, which is a little lesion on the tendon that allows you to do this kind of movements.
Mm-hmm.
So it takes time to recover. Okay, I would say that probably it's in between 4 to 6 weeks to recover.
More?
Yeah.
You reckon it's gonna be 6 weeks more from now?
Yeah, like since it's a tendon like they have a lesser blood flow respect of muscles, so it might get even more. But the pain will get better as long as you keep doing the exercises and you try to pace. So definitely, I would suggest you to get some rest, especially from work. I understand your situation, but even being in the position to talk about them, to say like, I don't want to quit, I want to go on, but even changing, maybe doing a bit more of office work as a nurse, like taking data of patient instead of doing movements or tough things, because every movement that you go up, it's gonna be quite
So
painful.
what should I do? Should I take leave, or what should I do? What do you reckon?
Oh well, like definitely try to get some rest.
Mm.
Okay, like we don't
Rest meaning to stay at home?
like being able to not doing that loading.
Mm.
So even if you could like try to change the way you work at the moment, would be helpful. I'm just trying to consider your situation that you've been
Yeah.
telling me about, but of course having some a period of leave would be good. Like like saying I'm having physio, I'm resting, I'm doing exercise to improve and to get better because I don't want it to get worse.
Mm.
So that could be an idea.
All right. So today's Saturday. When should I come again?
I would say Tuesday.
Tuesday.
I
Okay.
would say we could do Tuesday and Fridays.
Yeah.
Is that
Sounds
alright
good
for
to
you?
me. Yeah, sounds good.
Fantastic. Thank you very much.
Cool.
It's been a pleasure.
Pleasure, my friend. I knew these things. Oh. Just in time?
47 minutes.
Ah, cool. Did great.